next bit. Well, quite a treat today for Ask the Expert for me. It is Breast Cancer Awareness Month, October is, and I'm a breast cancer survivor, and this is my breast cancer surgeon. Dr. Clark Rasmussen did my lumpectomy, and we'll talk a little bit about the treatments that we have available now. I imagine some people just automatically think if you have breast cancer, you're going to have a mastectomy.
There's a certain percentage of women and patients that I see that will come in and they already have their mind made up. Some say, I want both removed, no matter what. Some come in and say, I want them saved no matter what. But majority of women do come in and say, what are my options? What should I do?
And you help walk them through that, not just what you say has to be done, but help them decide.
Yes.
Because everybody's different.
Right. And every cancer is different. And there are sometimes limitations as far as what we can and can't do and can and can't offer them. But I always really try to enforce to women that if you have breast cancer and you have a lumpectomy can be done safely, and you compare it to a mastectomy, if you compare stage to stage, your survival is going to be the same.
Okay.
And that's very important for women to hear, that you have options that are not going to affect your survival.
That's right. And everybody's in it for your best interest, for the patient's best interest.
Yes.
And I found out, I mean, you talked through, did I need a lumpectomy? Did I need a mastectomy? Did I really need chemo and radiation? And some, yes. But I have a friend who just had a double mastectomy. She didn't have to have chemo or radiation. But I'm glad I didn't have to have a double mastectomy. So really, everything's different.
And that's the thing, is you have to individualize the treatment. And at Intermountain Healthcare, we actually have a weekly tumor board that meets, and it's not just one physician saying this is what we should do with this patient. It's a group of physicians, and it includes surgeons, it includes medical oncologists, radiation oncologists, radiologist, Dr. Parkinson, you know very well.
And I had that over my tumor, and it really helped me a lot. It's not just a second opinion. It's a third, fourth, fifth, sixth.
Usually around 20 to 25 physicians attend this weekly.
And there are so many treatment options now available, and early detection. And you say early detection is what gets us to you in time to save their life.
And that's the key, and I have to say, I have to push the plug for mammograms because that is so important. And up until a year ago, Utah was the second worst state in the nation for mammograms. And I just heard we
still are.
I just heard some data that we got a little bit better.
Okay.
But we're still not out of the bottom 10.
Okay. Well, so, a little bit better. But a mammogram saved my life.
Yes.
It got me to you in time to save my life.
You haven't. I mean, your stories are well documented on TV, and it's an awesome story.
We hope there are more life-saving stories out there to get your mammogram. But in the meantime, you can call about any questions involving breast cancer. If you have insurance questions, anything, they can find the right answers. So do that today. They'll be here till 6. So Ron and Chase, get your mammograms.